We will next be entering our keynote lecture about interventional pulmonology service in Jaminan Kesehatan Nasional, which will be delivered by the Direktur Jaminan Pelayanan Kesehatan, representing the Badan Penyelenggara Jaminan Sosial Kesehatan. To Dr. Lili Kresnawati, MKes, the floor is yours, Dokter.
Terima kasih. Apakah suara saya cukup jelas ya? Suara saya sudah cukup jelas?
Jelas, Dokter? Terdengar, Dokter?
Oke, terima kasih. Mohon maaf.
Agak kurang keras ya mungkin dia.
Agak kurang keras?
Ya.
Tes? Sudah cukup?
Ya, cukup, Bu.
Baik, terima kasih. Mohon izin, ini kelihatannya presentasi kami dipersiapkan dalam bahasa Inggris. Saya akan mulai. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Shalom, Om Swastiastu, Namo Buddhaya, salam kebajikan. Good morning to all distinguished guests, speakers, and all audience, ladies and gentlemen. Praise to Allah Subhanahu wa Ta'ala, God the Almighty, for the blessings so that we all gather here virtually, hopefully in good condition and health. First of all, our President Director, Professor Ali Gufron, sent his regard and apologized for not being able to present by himself. And on his behalf, I'd like to thank you for the invitation to give keynote lecture in this respectable webinar. Along with me, there is also our Deputy Director, Dr. Elsa Novelia, and Assistant Deputy, Dr. Muhammad Zakaria. Next slide. Next slide. Yeah. Yeah, JKN overview. Next slide. Okay. As we know that our JKN KISS program has run from 2014 until now, and starting this year, 2021, in order to give a better service for all the insured, we have launched 4 quick wins programs. First is improving service quality in customer journey, focusing on reducing the queuing time using innovations such as online queue with mobile JKN, fingerprints, and also face recognition using AI. The second is engagement or involvement of all stakeholders to support and having a sense of belonging to program JKN by conducting programs called BPJS Kesehatan Listen, to get as much aspiration from all stakeholders. The third is expanding the coverage of the insured by increasing community participation and developing alternative funding for the JKN such as CSR and philanthropies. And last but not least, maintain the sustainability of JKN KISS program. Next slide. Next slide. Yeah. JKN program started on January 1st, 2014, now has covered over 83% of population and growing from year to year. By May 2021, we have more than 224 million insured. The majority of JKN participants is still indigent member that covered by national budget. From 2016 up to 2020, health facilities has also grown in around 11.27% in primary care facilities and 21.23% in secondary and tertiary health facilities. Now there are 22,000 primary healthcare and 2,592 secondary and tertiary care facilities all over Indonesia. The JKN healthcare utilization has also increasing year by year, and the most visit is at primary care facilities. The JKN revenue and spending was in a gap since 2014 and start to balance since 2020 due to premium adjustment. Next slide. JKN has digital ecosystems that connects all operational activities through system automation and integrated services, starting from membership, premium processing, until claim administration processes. We also connected to several ministries and other parties as well. The IT support is very important in managing the operational of large GKN transactions and is developed and improved throughout the time. Next. In JKN KISS program scheme, the insured is given access to primary health facilities first, such as public health center, clinics, physicians, or dentists. And if after the assessment, the patient should obtain a further treatment in a higher level, then they will be referred to the secondary or third health facilities based on medical needs and necessities. The referral system is compulsory for patient and health service providers. And the service are carried out in stages according to medical needs, starting from primary healthcare facilities up to the higher level facilities, except for emergency cases that the participant can go directly into ER in hospitals. Next. As we know that JKN program, there are medical benefits which refer to health services based on medical indications, and the non-medical benefits such as medical equipment and accommodations. According to Presidential Decree number 82 2018, JKN KISS covered all of the medical indication as long as not covered by any other program and not listed as non-covered. Next. The pulmonary intervention. Pulmonary intervention subspecialty dealing with airway respiratory disease, lung cancer, and pleural diseases has played an important role in JKN program. The high number of cases in respiratory system and pulmonology related disease makes it very challenging for us to be able to deliver a more effective and efficient service. Next. If we look at the data in our business intelligence, the respiratory system group has reached the third rank of top 10 in a CMG list after ambulatory group and nephrourinary urinary system. That is why it is challenging. Next. And as we seen in the map there, the red color of the map, most of CMG respiratory disease cases in 2020 was predominantly found in Java Island. Next. You see, according to the age, CMG respiratory cases in 2020 was found highest in the age group of 0 to 05 years, followed by 56 until 70 years. And so a lot of effort should be placed on those particular age groups to prevent more cases. Next. Yeah, next. Yeah, this is the breakdown. The previous one, sebelumnya, yang sebelumnya. Yeah, this is the breakdown of top 10 CMG respiratory cases list from 2016 to 2020. And from this data, we can see that most of the outpatient cases was the procedures of lung disease groups, meaning that intervention has become quite dominant. As from the inpatient data, we can see that there are still high number of cases of mild lung disease that must be treated. In fact, 8 out of 10 top CMG respiratory cases in inpatient are mild and moderate cases, while only 2 out of 10 was severe lung disease and procedures group. But as we observe the last list of inpatient cases, it seems that the group severe non-complex respiratory system procedure has a quite significant increase from year to year. So it is likely that pulmonary intervention services will grow higher every year. Next slide. Next slide. Ya, sebelum ini, ya. Based on data from 2016 to 2020, we can observe the increasing trend of total cases in line with the increasing of cost and unit cost of pulmonary intervention services. Although there is a slight decrease in 2020, perhaps due to pandemic COVID-19, it seems like the increasing in unit cost is still remain. So I believe it should be our common concern in preventing the increased cases of pulmonary disease that leads to interventions. Next. Challenges and hopes. Next slide. The challenges are, first, pulmonology intervention service in JKN program is guaranteed according to medical indications and implemented within the principles of quality control and cost control. The second, we are strengthening the preventive promotive services by intensifying the preventive services within the 3 levels of prevention, from health promotion into early detection and prompt treatment. And refinement of the referral system by performing the referral systems in stages based on medical necessity to the health facilities with suitable competency. Next slide. So for the resume, for the better service in the future, we do hope and expect the support from all parties, including medical staff, to understand JKN regulations so that there will be no more misinformation in delivering the service. And we also hoped that very soon there will be established PNPK or clinical pathway as a guidance for us in conducting the verification and management of the insurance claims. And the third, we also expect that the pulmonary specialists shall be well distributed throughout the country to assure that all participants have proper access to the service. Hopefully, JKN services in the future, particularly pulmonary intervention service, becoming much better and shall contribute positively to the health of the nation of Indonesia. Amin. Before my closing remarks, I would like to apologize for not be able to stay until the end of the discussion due to my other duty in other ceremony. But my deputy, Dr. Elsa, and staff will be staying here to assure that we take notes on important issues to be addressed while improving the program of JKN. So, ladies and gentlemen, thank you for your kind attention, and we look forward to see you again in other occasion. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Om Santi.
Waalaikumsalam
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Dr. Lily, for your enlightening lecture. Ladies and gentlemen, we have just been informed that Professor Suri isn't available to deliver his keynote lecture today, and so it will be rescheduled for the next week. And thus, that ends our opening ceremony for today. Ladies and gentlemen, we will now have a half-hour coffee break. But before that, I would like to remind all of you again that certificates will only be given to participants who attend at least 70% of the whole webinar, and that there will be door prize announcements every Sundays after the e-poster sessions. So, ladies and gentlemen, please have your coffee break, and we will be coming back again at 9:35. Thank you and enjoy JIC CIM 2021.